nice is there's actually a collection of articles that were posted in May of 2023 around the integrated care workforce. So the collection itself is kind of holistically titled Integrated Care Workforce, What Does It Need? Who Does It Take? And it's through the International Journal of Integrated Care. And the articles are all available through Creative Commons license. So I was able to download those and add them to iEcho. And the links are also available in these slides. So you should be able to get full access to both of the articles that I'm going to talk about briefly and to the collection as a whole, because it is a pretty nice collection. There's a variety of articles in that collection that are worth taking a look at. They cover different types of things. But we'll talk about two. One is an editorial piece that just kind of gives an overview of what the collection is and the various things that the various articles are looking at. And then the second is a perspective piece that looks at some of the possible tensions arising in integrated care. So the first, the editorial, so it talked about how the various articles throughout the collection were looking at questions, things like, how do you teach integrated care? What's the importance of the workforce roles to support integrated care? How do systems move towards a continuous learning system which reinforces what you teach? What are some theories or concepts, approaches, or disciplines that are necessary or useful to learn from when we're thinking about integrated care? What support does the workforce need in that transition from kind of fragmented, siloed care to integrated working collaboration? How do you empower existing professionals to work within a team environment, engage in new relationships, and introduce those individuals to new kinds of roles? And what are some of the best examples which illustrate the development of resilient, compassionate, sustainable integrated care workforce? The editorial authors note that while there has been a lot of various kinds of trainings that get pushed out around integrated care, things that are just short-term or focused trainings aren't really sufficient if we want to embed the values of integrated care into our work ethic and into our workforce culture. They highlight that integrated care workforce is viewed as much more than just the health and social care professionals, but that our integrated care workforce really comprises of peer supports, community health workers, volunteers, community groups, and our patients and caregivers and families. But we also need to be very clear about who we mean when we're discussing the integrated care workforce from one context to the next. As all of you know, in doing integrated care work in your various types of practices, what that looks like, what integrated care looks like, differs from location to location, and it can be very broad. So when we're talking about a particular practice or a particular practice type or where you are, we just need to be very specific about who we are including, and are we potentially missing other people that could we expand this more and be more inclusive in our approach? They note that the education and training is still largely siloed within each of the systems. The digital and technological solutions are often described as occurring and being developed in parallel rather than ingrained within integrated care, which ends up making it feel like it's more of a burden than solution or a supportive resource than it could. And that very often, too often, integrated care is implemented really on top of everything else. So it's not like it's taken out as like, this is what we're going to do and we're going to carve out specific time to be able to do this well. It's just, well, now we have to do this too. And we see that in a lot of healthcare across the spectrum, but it really does take away from some of the value that can be derived from doing integrated care. The other piece was a perspective paper, and I think this is the one that I'm hoping will generate a little bit of discussion, because it really looks at the tensions that develop. And so we know that to achieve true integration, and they're defining integration as the effort to improve the quality of care for individual patients, service users, caregivers, families, by ensuring that services are well coordinated, involve collaboration across the individual needs and the different care environments. We know that collaboration is critical to doing any kind of integrated care, and yet different professions, specializations, health sectors, sectors of social care all have to find a way to come together while bringing their complementary skills and expertise. That said, when you bring together a wide array of individuals, each having their own culture, professional ethics, values, and identities, there's inherently going to be some tension that can develop. So this article is really looking at some of the expected tensions, so the different expectations and conflicting demands that maybe are brought from different sectors of the health system, and that often these tensions are not openly discussed. The graphic here highlights some of the potentially opposing perspectives that need to be considered. So whether you're coming at this from a provider versus a community member, as an evaluator versus a manager, somebody who's looking at regulation and policy versus somebody who's using the care. All of these individuals in different kinds of roles may have opposing and some complementary, views, interests, values, but we have to anticipate that there's going to be tensions there. In the context of evolving healthcare, that means newly developed approaches might conflict with established practices, internal guidelines. Sometimes internal guidelines conflict with the external needs of users. And then individuals' desire for autonomy can often conflict with standardization. And the more complex the care processes are, the more perspectives that are brought together, and the more complex the interests are, the greater potential for tension exists. And the authors contend that tensions can go one of several ways. One is that care continuities and processes are disrupted by the conflicts between the professions and disciplines, or that this results in the development of new solutions and progress in the implementation of integrated care. So they highlight the importance of examining potential tensions, as you can only cope with that which you can understand. They suggest that to effectively manage integrating care, one should seek to better understand the characteristics and types of tensions, the potential causes and sources of tensions, and appropriate management strategies. And they highlight 4 main categories of tensions that these can fall into, that were described by Smith and Lewis in 2011. So one of which is organizational tensions. So those would occur when multiple organizational systems are combined, and they may have competing designs and processes. Performing tensions occur primarily when multiple individuals pursue divergent goals that are all necessary for the collaboration, but are figuring out how to make that work is a potential source of tension. Learning tensions, so those involve using and destroying maybe past practices to create new ones. And then belonging tensions arising from competing identities. And these can occur, among other things, when tasks are being attempted to be shifted or reassigned or changed, even kind of crossing typically established professional boundaries. Having professional autonomy versus working as an interprofessional team. And the diagram looks at the 6 cross-cutting categories, because certain tensions aren't going to be able to be assigned to just a single category, but they kind of fall in both. So performing and organizing, or learning and organizing. And so they kind of highlight all of the spaces of these being places that we might see tensions that are each going to need different strategies and approaches to managing them. And the authors kind of conclude by saying that effective management of tensions and the dynamics associated with them are potentially areas for contradiction and challenge, or for there to be new strategies and new things that come out of it that allow us to do better integrated care. They describe 3 basic management strategies that can be shown to help promote what they call virtuous cycles and help avoid vicious cycles. So virtuous cycles being, we're going to create a new system, versus vicious cycle, and we're going to just get into sources of conflict. So either or, which would be separating conflicting demands and resolving the conflict by choosing one element over the other. Both and, achieving a balance between the conflicting sides and integrating them to create something new. And more than, so developing a whole new perspective out of whatever the original conflict was, and creating some new element that surpasses the existing divergent interests. The authors really contend that the existence of tensions is not a bad thing, but how those tensions are managed might be. They suggest that concrete activities to manage tensions in the context of integrated care should be done through change management strategies, and should account for the tensions that exist. So we need to foster communication across all of the individuals involved, try to create some kind of central coordination, and establishing an understanding of the goals and views of all of those professional groups and identities involved in the health system. So that's kind of their perspective, but I'm curious about how this might apply to your practice and workplace. And while it was not part of the articles, I feel like there are all kinds of new tensions that are arriving into our integrated care work that I'd like to hear from all of you. So I will attempt to stop my share if I can figure that